I'm Christina Signorelli. I'm a research fellow at the Behavioural Sciences Unit, which is located across Sydney Children's Hospital and the University of New South Wales. And I guess in a nutshell, my research is really focused on understanding the needs of people who have survived cancer. So we're thinking longer term, and particularly childhood cancer, so having been diagnosed under the age of 16, and then developing an intervention and models of care around that to help ensure that the impact of cancer is as minimal as possible for the many decades of life that they have after treatment has finished. There's a lot of challenges in delivering survivorship care to survivors of childhood cancer, and particularly in the long term. So they are treated as children for a paediatric illness, but then they've got the rest of their lives to tackle the many health problems that might arise as a result. So although they're treated in the paediatric system, they do traverse the adult system later in life, and there's a lot of complexities in navigating that. And so really try to take an innovative approach in terms of educating and empowering survivors about their healthcare needs and the longevity of that. Helping health professionals, particularly in the primary care space, so outside of specialised services, to understand their risks as well, and to understand the ways that they can support families, both in terms of their mental health needs and their physical health needs as well. And so we really have leveraged things like digital health interventions and efficiencies through assisted or AI technologies to increase efficiencies in the healthcare system, and to make sure that survivors have as much information as possible in their hands and can take that to the many health professionals that they might see, and those health professionals will then know what to do through that communication and that support. I guess for me, and I guess a lot of people have been touched by cancer in some way, shape or form, whether that's knowing or caring for someone with cancer, and that's certainly the case for myself, or having had a cancer diagnosis themselves, or interactions with the health system, even screening for cancer. So particularly in the paediatric space, it's hard not to be passionate about this area of research and to want to be able to create change, and then to do that through the mechanisms of research and collaborative work with the wonderful health professionals and clinicians that really drive this. I think it's such a privilege, and as I said, it's hard not to be motivated day to day by that, but also as a bit of a nerd, to also be able to indulge in exploring data and things like that, and using that to create real change for people whose lives have been impacted by cancer. I think I'm most proud of just the integrity of the research that I've done. So, it's not something that I've been able to do overnight. It's a program of work that I've had to build on and have had the pleasure of working on with many other academics, patients and people with lived experiences, healthcare professionals, and that's been across a decade just to get where we are in this sort of current state of things. So I guess just having that persistence and that integrity along the way to ensure the best possible outcomes and to create impact, but to acknowledge that can take time and that doesn't happen overnight. I think it's a really exciting time to be in the cancer research space and to be working in this field at the moment. I think in terms of what I'm most excited about, I think there's been a lot of changes in recent decades, and we get to celebrate a lot of those successes, particularly around treatment improvements, for example. And I think for me, having a psychosocial background or a background in psychology, I'm most excited about seeing how we can ensure that supportive care isn't just the support act anymore, that it is brought to the forefront at the very start of diagnosis and treatment, and that we can prevent a lot of health issues that very clearly are linked to physical health as well. So by tackling both, hopefully we can ensure a more positive cancer experience for anyone who's impacted by a diagnosis, either in childhood or adulthood as well.